This Be More Lifestyle segment is sponsored by CH Communications. Well, there's been a shocking surge in overdose deaths. Data from the U.S. Centers for Disease Control and Prevention point to one potential culprit: illegally manufactured fentanyl. Well, pain management expert Dr. Shravani Durbhakula is joining us now to tell us more. All right, so welcome to Be More Lifestyle. So this class of drug, often prescribed by doctors to help people experiencing severe pain, right? But do you think it's being overprescribed?
I mean, I think there's still some overprescribing going on. Doctors have gotten a lot better with prescribing due to lots of efforts federally as well as locally. And a lot of the overdose deaths are not because of doctors who are prescribing these medications, but really it's like the illicit stuff, the fentanyl, like you mentioned. That being said, when doctors prescribe these medications and then they don't taper them or wean patients appropriately, then those patients might go out and find this illicit fentanyl. And so there is still a relationship there, but directly prescription-related opioid overdose deaths have declined.
So it seems that a lot of people don't know that there are alternatives to treating chronic pain. Can you talk to us more about those?
Yeah, there are lots of alternatives. Chronic pain is really multidisciplinary in terms of it's not like an appendix. You can't just sort of cut it out and it goes away, right? So it has to be treated from many dimensions. So there are things like medications, but there are also other things like procedures, which is what I do a lot of. There are multidisciplinary therapies, including cognitive behavioral therapy and pain psychology, sort of mindfulness type of therapies, as well as yoga, acupuncture, and lots of alternative stuff. And it's really when patients get that full holistic treatment from multiple angles that they do really well.
So you're currently doing government research about medical devices to help alleviate the pain, but do you think that a lot of doctors are embracing that?
CMS would tell you that the usage of these medical devices for pain has increased in the last year, and even perhaps out of proportion to the increases we've seen in other treatments. That being said, it's still not enough. There are lots of patients I see who come to me that are good candidates for these devices, but nobody has ever mentioned them, these devices, to the patients before, and they're learning about it for the first time. So there's an opportunity there, and I think there is more education needed in terms of people knowing about them, patients, and even providers before they see a pain specialist, so they can get them to us faster and we can get those devices in them.
For sure. Well, I know a lot of our viewers can relate. Somebody knows someone who's dealing with chronic pain. If they want to reach out to you, tell our viewers how they can find you.
Yeah, absolutely. You can reach out to us at Johns Hopkins Medicine at the Blaustein Pain Clinic, and it's 410-955-PAIN.
All right. Also, we have that information on the bottom of our screen as well. We'll put it on our website, foxbaltimore.com. Thank you so much for being here with us.
Thanks for having me.